Walk down any corridor, visit any floor, and you will find them. Volunteers at Dartmouth-Hitchcock Medical Center, everywhere at once, here to help in any way they can. Their willing hands, their good cheer, their generous hearts, all contributing to the health and care of our patients. From the earliest days of the hospital, when auxiliary members sewed bandages and collected vegetables and canned goods for the hospital from local gardens, volunteers have been essential partners in our work of caring and healing.
Good afternoon, everyone. Here it is 2 o'clock. You're tuned to Channel 32, and it's a Tuesday afternoon, so that means it's time to play Hospital Bingo, right?
I look for team players. I look for people that are willing to go with the flow, because nothing's perfect and we need to adjust to a variety of changes, especially now. I look for people that are willing to learn and adjust as things change around them.
I mean, I'm known as Bingo Bob throughout the hospital world and also in the civilian world. I mean, it's sort of embarrassing. I can get on an elevator here in the hospital, and some mother will say, "Oh, look, Willie, that's Bingo Bob."
Besides patient bingo, our volunteers are recruited for nearly every medical center department. They escort patients for appointments, treatments, admissions, and discharges. They may be in an office somewhere collating patient education materials. Dartmouth-Hitchcock has a pet visiting program that specializes in TLC brought to the bedside by volunteers who make rounds with their canine partners.
Everyone is always happy to see a dog, and while they might not always be excited to see me, when I have my dog at the end of the leash, their whole disposition changes, and it really does make a huge difference. And I think that, you know, anytime you make a connection, whether it's, you know, dog to person, person to person, that's really very important.
Volunteers greet the public at the information desks and serve as hosts in surgical waiting areas. There's no end to the work they do. Madeline spends 4 hours a week running the Norris Cotton Cancer Center Patient and Family Resource Center. She helps patients find information about cancer and cancer treatment in the library's reference books and on the internet.
I really get a lot of pleasure out of trying to help people kind of ease their fears by giving them information about whatever they need.
Many people come here because they've had a good experience at Dartmouth-Hitchcock and they want to give back. So many of our volunteers were either patients themselves or family members of patients.
Oh, Madeline, that's wonderful.
I have often said, I understand what you're going through. I've been through this. Especially some of the women who are fearful of losing their hair. I often will tell them, well, I've lost mine twice and it's come back. And so don't worry, it's temporary kind of thing.
For many, it's this close contact with people that helps them find a purpose in volunteering. Bob Bausch volunteers in radiation therapy. He's had radiation treatment for cancer himself, and he understands what patients go through. He remembers talking to one man who was depressed about the difficulty of treatment.
I went in the other room with him and sat down, and we talked for about a half an hour, right after his treatment. And he thanked me and went on his way. And the next time I saw him, he came up to me and said, "I've never been lifted quite as high as it was when you talked to me." And we had a nice chat.
Bob and his wife Delores volunteer together.
We travel together, we do things together, and it's just something that we share, and we both feel very, very strongly about it.
Delores volunteers in the Pink Smock Shop. This is the hospital gift shop, managed by a paid staff person, but volunteers do most of the day-to-day work. Volunteer Karen Terry is a jewelry buyer for the Pink Smock.
You want to do 6?
Yeah.
I must say, I'm having the time of my life. Jewelry representatives come to the shop to show us their wares, and I try as a buyer to buy all different price ranges so that a small child can find a trinket for his mom, and the doc who forgot his wife's birthday can find something special for her as well.
Money from the gift shop is given to a variety of programs around the hospital. A generous portion is dedicated to providing nursing scholarships.
The Dartmouth-Hitchcock Medical Center Nursing Auxiliary Scholarship is a scholarship fund. Right now it was $40,000 for this year, in which employees who are interested in becoming nurses, or nurses who want to complete their baccalaureate degree, get a master's degree in nursing, or are studying for their doctoral degree in nursing, apply for funds to assist them to be able to pay the bills to go back to school. It's an extremely generous gift. We have a number of people who have been secretaries or transport people or in other parts of the organization who have already been employed here who now become nurses.
Funds from the Pink Smock Shop provide food vouchers for families of children who are spending time in the Children's Hospital at Dartmouth. Money from the gift shop also paid for much of the art that decorates the medical center's new buildings. Volunteers come from all walks of life and represent an age span from 14 to 92, but most are retired.
I didn't want to sit around. My wife and I were both rather active, and I wanted something to do, so I came and volunteered. I started out as an escort. I wanted to stay active, and the hospital seemed to me to be the opportunity. So that's where I chose to volunteer and have never regretted it.
Some, like Nancy Bassett, find that volunteering is a way to continue using their special abilities and training. Nancy Bassett volunteers as a patient representative.
I majored in sociology and psychology in college, and this is the way I have used that. When I visit a patient, I introduce myself as a patient representative, and I say, I represent you, and I am here to see how you feel about the level of care that we're giving you, and what is your perception? How does it feel to you? And are there any things that we could do better?
Like all of our volunteers, Nancy is supported and respected as a peer by hospital staff.
The patient representative volunteer helps us, helps what I do as a staff member by helping me provide support for my patients, giving them another resource of somebody to talk to give feedback to check in and make sure they have everything they need.
When they say thank you for caring this much and asking this much, or when they are willing to sit down and talk with you and express their concerns and know that perhaps you can help them, that's when I feel the most successful.
I think the volunteers stand tall with all of us. I think we respect them. I guess we can look at them as colleagues, fellow workers for us. When it really gets crazy here in the emergency department, which it will go from being perfectly quiet to 10 or 15 minutes later insane. And we will have sometimes repetitive traumas, 3 traumas right in a row with another one coming, and with 2 helicopters flying now. Then all of a sudden we have to start moving stretchers and we have to start moving patients around. And the volunteers will jump in and do this. And we depend on them. And at times, and they know it because of the way that they're treated by the staff.
The hospital's Volunteer Services Department oversees the work assignments of volunteers, but the volunteers have their own organization and board.
The auxiliary board is comprised of volunteers that lead various roles at the hospital. One might be the escort chairman, one might be the information desk chairman, a critical care or surgical care waiting room chairperson. And so all of those people have their own areas of expertise, and then they come to board meetings, help make, not legislation, but have an impact on the coming events, and making sure that our volunteers are informed in their respective areas. A huge part, I think, of being on the auxiliary board is the lifelong learning that it entails. at each one of our board meetings, there's always a speaker. And so we're able to learn from them and then take that wisdom and those skills learned at the board meetings and apply them then to our roles and to educate all the other volunteers as well.
Why volunteer? People give any number of reasons.
Well, look at the wonderful container.
You get to make some friends.
I think the social aspect is important, especially living here in the wintertime. We tend to be I can tend to be a couch potato. It gets me out, it gets me with people.
Number one, the people that you're working with as volunteers are wonderful. I mean, it becomes like a family. I mean, it's a lot of fun.
The reward of volunteering for me really is playing music in this space. Sometimes people tell me that they like the music, that it really soothes them and mellows them out. But for me, it's playing in this space and this sound here that there isn't anywhere else. I mean, it's sort of special.
John Markowitz came to volunteer and ended up with a career in healthcare.
My background is not a medical background. I came to the emergency department in 1991 when the hospital just moved to the new location. Started volunteering. I was a Thursday night guy, which was really neat. And I volunteered for 5 years before one of the nurses said, why don't you take some training and work here? And I thought, well, that sounds like a neat thing to do. So I did. I became an LNA, and then I started doing per diem and call hours.
John is a licensed nurse assistant in the emergency department, and he also supervises volunteers there. Some of them are also discovering that volunteer services can be a path to a career in healthcare.
We have people from the community who come here, teachers who are looking to change their profession, or people working at different jobs in the community are thinking, well, is the medical field for me? Is there something there for me? And they'll come and they'll volunteer. We have one gal who's a Dartmouth grad who has been volunteering for us regularly, a real sweetheart, and she is looking seriously enrolling into a degree nursing program and becoming a nurse. So different times, different volunteers come here and embark then on a profession in the medical field.
People who are interested in volunteering start by contacting the Volunteer Services Office at Dartmouth-Hitchcock. They are asked to visit the office to fill out an application and meet the director.
I have a specific series of questions I ask every volunteer in the interview that helps me pin down what their motivations and needs are. Many volunteers have a variety of needs as to why they're here. If they're here for social interaction, they need to be in a program where they're interacting with a lot of different people. If they really want to use office skills, then they're going to be more comfortable working alone. The question that tells me the most is what would make you feel successful as a volunteer? And then I know what we need to do to make sure they have the right role.
Volunteer office staff keep in close contact with volunteers, offering support and placing people in situations where they are most helpful and comfortable.
I would say go down to the volunteer office and just look at the list of all the opportunities that are available to volunteer. If you're not too sure, you can follow somebody for a day on escort or sit by the volunteer at the information desk or any other positions and test it out. You don't have to jump right in. There is a training program, there is a guidebook, so that you really can find out what you do and what's expected of you. It does represent a commitment. It's not just something you do if there's nothing else going on.
Our volunteers are dedicated, generous people who know the rewards of giving time for others.
So you have to have an outlook of helping your fellow man to a degree. You're giving back what was given to you, or you're trying to.
Knowing that I made a connection with one person maybe. I could be here for 4 hours, but maybe it was just one person that I felt I really helped that day. And that alone is enough for me to keep me coming back.
If you had said to me when I first started volunteering here that I would be working here in the future, I wouldn't have believed it. It's a compelling place. You get caught up in the excitement, the good work that is done here by so many people.
What I hear from volunteers are the rewards that they feel, are all the friends that they've made here with both the other volunteers and the staff, the physical exercise they're receiving, but most of all the thank yous and the handshakes and the pat on the back they get from patients and their families, because those are the people that really receive the impact of the volunteers.
I get great pleasure out of being here. I enjoy the interaction with the patients, with the staff, the nurses. I see my former doctors and those that I haven't met, you know, see me as a familiar face, will say hello, and it's nice. It's nice being here.
Well, I love it.
Yeah. But I got them to fix my TV.
Volunteering is a very special part of my life, and there's no question. On Tuesdays, that's where I want to be.